Welcome back, Zoe. So we are coming back for part 2. We did some deeper filler treatments in the cheek, the jaw, and the piriform fossa about 4 weeks ago now, wasn't it? Or thereabouts. And today we're going to be doing the second part of that, which is some biostimulatory treatments. And in today's case, that's going to be an Ellansé treatment. We're particularly going to be focusing, again, coming back to our GEM principles, on the lateral part of the face here. So that's going to be along the lateral part of the zygoma, the pre-auricular area, and towards the mandibular angle. And we will be trying to get as much stimulation here as possible. The view tournament is there to help with the lower face here. Then when we come back for stage 3 of the treatment, we'll be able to use less filler in this medial part of the face to get the results that we want. How's that sound, Zoe? Good. Fantastic. We're going to be starting with our Ellansé treatment now. So this is a biostimulatory treatment. We're going to be focusing in the subcutaneous layer, particularly in the lateral part of the face. So coming back to our GEM principles, we're starting with deep, then lateral, then superior to inferior. So we've done our deep filler treatments, and now we're going to be starting with our lateral filler treatments back here. So one of the core principles with the in the midface and the lateral midface is this line of ligaments that runs from the orbicularis retaining ligament here, the zygomatic cutaneous ligament, and the mandibular retaining ligament down here. And we know that everything lateral to that line of ligaments, there's going to be very little movement because we have the zygomaticus major and minor muscles here. And that means that we can get away with treating more superficially to help restore some of the volume loss and some of the elastosis in the skin posteriorly. If we were to treat very superficially immediately, we'd find that because of the pull of these lip elevators, lots of that product would bunch up and make the eyes look a little bit smaller. So if you give us a really big smile now with your teeth, we can see that lots of movement medially, but lateral to this line of ligaments, and relax again, and then really big smile again, there's almost nothing there. And relax. So we're going to be focusing along the lateral zygoma. I'm going to palpating the inferior border here. Zoe is blessed with good cheekbone structure anyway. So that is something to bear in mind when we are doing a filler treatment here. We don't want to over-project the lateral zygoma with filler. The effect that that's going to have is it's going to make everything above it and inferior to it look more hollow, which is actually going to be probably a bit more aging. Whereas a biostimulatory treatment that's focusing more on the skin quality back here is going to definitely be the right thing compared to that projection. The next area is going to be in this preauricular lateral cheek fat. And we can see that there is a little bit of hollowing and deficit there. And we're going to be, I can just mark out where that is, coming all the way back towards the tragus. And I'm going to be particularly focusing on this area here where I can feel, I pinch the skin and it's taking a couple of seconds to ping back. And then down towards the mandibular angle, I'm looking at where, the mandibular angle is there, and then palpating, and I'm right on it there. We've done some deep supportive treatment under here, and I can still feel where that's added the support. But again, if we do that pinch test on the skin, we can see there's a degree of elastosis there. So improved collagenesis underneath there will help support the lower face. So we've got the treatment along the zygoma. That'll help support the midface, the preauricular again, and then along the mandibular angle, the lower face. We will be dividing the treatment out. We'll be doing one syringe on the right-hand side, one syringe on the left-hand side, and spread out between all 3 of these areas.
Sorry to interrupt this video. Hi, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I'm the one doing the injection that you're watching right now. I just want to take a moment to talk about our injectables diploma. So Harley Academy is a higher education college for aesthetic medicine based out of the centre of London, UK. and over 3,000 medical professionals have gone through our academic programs to achieve a postgraduate diploma in aesthetics. They will get a title after their name, PG Dip Aesthetics. If you want to learn more about our programs, how you can gain your qualification and learn how to inject in a really structured, systematic and evidence-based way, then click on the details below and our team will be happy to have a conversation with you. Right, that's enough from me. Let's get back to the video. But if you are enjoying this and you want to see more content like this, please subscribe and click like.
This is our Ellansé syringe here. These come with 1 milliliter of product in, and the product is polycaprolactone, or PCL for short. It's a relatively thick product, and the manufacturers recommend that in order to make it easier to inject for us and more comfortable for the patient, that we add a small amount of lidocaine into the mix. So I've added 0.2 milliliters of 2% lidocaine. That's going to reduce the extrusion force and make it significantly more comfortable for the patient. So I'm making my first entry point on the zygoma, just on the apex of the cheek. Sharp scratch in 3, 2, yeah. Now I'm going to be using a 22 gauge, 50 millimeter cannula. So this is the layer we want to be in, the subcutaneous layer. We're going to advance our cannula in there too, making sure we're not diving too deep. When you're subcutaneous, you'll feel these little adhesions, and that's completely normal. Do a twisting motion and counter traction on the skin. Makes it easier for you and again, more comfortable for the patient. I'm now going to be fanning my product over the zygoma, just superior to it as well, and just inferior to it as well, keeping constant pressure on the plunger.
Great. And whilst you're doing that, Max, I'm just going to talk through some of the anxieties that I think certain practitioners have when they're thinking about injecting biostimulators, because one of the levels of comfort people have when it comes to fillers is that they can be dissolved with hyaluronic acid. All of a sudden, if we start using biostimulatory fillers, we enter this world where we don't have a reversal agent when it comes to vascular complications. And so, rightly, these treatments belong in a category for more experienced practitioners. And generally, we'd say that practitioners shouldn't really start to think about using biostimulators until a few hundred cases, up to 1,000 cases down the line. However, biostimulators have a really important function in how we manage holistically our patients' concerns, because ultimately a lot of what we see when it comes to the signs of our patients' concerns are related not just to volume loss, but also laxity of the soft tissue. So that's, as you mentioned, in the skin, we lose we lose collagen, we lose elastic fibers in our skin. And so there has to be some form of regeneration or biostimulation if we're really going to get the most natural kinds of results. And so biostimulators have their place. There's a few things that we do to mitigate the potential risks of vascular concern in the absence of having a reversal agent. So should we talk through some of those, Max?
Absolutely. So a lot of it is going to be in the device that you're using as well. So here I'm using a 22 gauge cannula, and we are always trying to find that balance between patient comfort and patient safety. And 22 gauge, as it's slightly bigger than a 25 gauge, means that the risk of penetrating the wall of a vessel is significantly lower, or certainly slightly lower than a 25 gauge cannula, whilst you're still maintaining adequate patient comfort.
So yeah, absolutely. But using a 22 gauge cannula, we would actually also be choosing to use a 22 gauge cannula in this part of the face with hyaluronic acid gels. But you can also see how Max is controlling his depth. The purpose of a biostimulator is primarily to target the fibroblasts within the dermis. And so even though there is some value in injecting deeper, we do have fibroblasts, we do have activity of biostimulatory fillers in deeper tissues, even in fat, even down on bone. The primary target is going to be the dermis. And so the way it's been described is that you're scraping the underside of the dermis with a biostimulator to try and get the maximum amount of stimulation.
And part of that isn't just going with the cannula injecting product. There's a degree of subcision as well. And you'll find in some people that the cannula glides and floats around very easily in this plane. Whereas sometimes you'll need to keep moving backwards and forwards to break up some of those little adhesions before you inject product. And particularly with biostimulators, but also filler, that's a really important part of preventing that product from accumulating along tracts. Because once it does that, the risk of having not necessarily nodules, but product accumulation and lumps and bumps that are harder to treat is much higher. So it's worth taking your time to do that.
Great. So in terms of risks, actually the main thing to be concerned about with biostimulators is not so much the vascular risk, but actually the risk, as Max mentioned, of nodules. And if we collect a amount of biostimulator all in one location, for example, if we created a bolus of a biostimulator just underneath the skin, then theoretically that little zone of skin could have a heightened degree of biostimulation, and that could lead to a little nodule of collagen. And so one of the key features of injecting with biostimulators is getting a nice even spread of products. And so more so than with hyaluronic acid gels, when we're injecting products like Ellansé, we have to make sure that we're consciously aware of the spread of our injection so that we're minimizing the risk of nodules. What we learned in aesthetic medicine even 1 or 2 years ago is now outdated. Why? Because aesthetics is still a relatively new science, and the research underpinning our work, particularly our understanding of anatomy, has advanced significantly. Hello, I'm Dr. Tristan Mehta, founder and CEO of Harley Academy, and I want to introduce you to GEM, the Global Evidence Matrix. GEM is a dynamic, evidence-based framework that gives injectors a clear, consistent guide for safe, effective treatments, all grounded in science, not in corporate sales pitches. GEM combines clinical research, anatomical knowledge, and injector expertise, and it's always updated with the latest evidence. Think of GEM as your interactive map for facial aesthetics, guiding you through every step from technique to product choice. With GEM, you're not just injecting, you're working at the forefront of medical aesthetics. Join us in setting a new standard for safety and results.
This is something that you could probably do over two pilot entry points. But when I want to do a more dedicated treatment down towards the jaw here, I do often find it easier to, even with a 50 millimeter cannula, to make a third entry point inferiorly, particularly if someone does have a few more little adhesions there. It's more comfortable as well for everyone.
So biostimulators theoretically have a much longer term action than hyaluronic acid gels. They should be having an ongoing stimulatory effect for up to 18 months. Usually your patients will come back 2, 3, 4 months down the line and still continue to notice an improvement in the skin texture, skin quality, skin tightness. And so patient expectations is really important for this kind of treatments. Unlike with fillers, you don't necessarily get this immediate satisfying change to the volume in the shape of the face, but it has a ongoing longer term impact, which is ultimately the effects of the type 1 collagen being laid down and improving the thickness and the physical properties of the skin. All right, Max, that looks great.
That's it. And we say that there's no immediate benefit, but we do find, particularly with products like Ellansé, that I have a gel-like structure to them, but before that collagen stimulation
kicks in. Bring your head back and just sit forward slightly. Great. We can see that you get some immediate benefit from the gel. And then as that gel breaks down, you then get the stimulatory effects. So we can see, if you just sit straight up there, that on the side that we've treated, where we've got now a little bit more projection along the cheekbone and structure along the jaw, as well as volume in the preauricular area, that the effect that that's had on the lower face already is significant. And the left side of the nasolabial fold as well has much improved. And that's just going to keep getting better.